Assalamualaikum and hi everyone. My name is Nur Diyana Huda binti Norizan. I'm from School of Physics, taking major Medical Physics. I'm the first student and my role in this group is as a scriptwriter.
Hi, my name is Nur Diyana binti Zaki. I'm from School of Physics. I'm a first year student majoring in Medical Physics and my role in this group is a presenter.
Assalamualaikum and hi everyone. My name is Nur Asyiqin binti Rahmat. I'm from School of Physics and I'm first year student of Pure Physics. My role is video editing.
Do you know what that is? Shortwave diathermy. No? Have you ever heard it before? No, it's okay. Let me tell you about the history of shortwave diathermy and introduce to you what is shortwave diathermy. As physician and biophysicist and Serbian-American engineer, they had been studying medical application for electricity in 1880s and performed the first systematic studies in 1890 of the effect of alternating current on the body, and discovered that frequency above 10 kHz did not cause physiological reaction but instead warming effect. Three methods have been developed and used to apply high frequency current to the body, such as contact electrode, capacitive plate, and inductive current. Nikola Tesla first noted around 1891 the ability of high frequency current to produce heat in the body and suggested its use in medicine. Austrian chemist von Zeynek first proposed using high-frequency current for deep heating therapy. In 1908, a German physician Karl Franz coined the term diathermy and performed the first extensive experiment on patients. He is considered the founder of the field. He wrote the first textbook on diathermy in 1913, which revolutionized the field. In the 1920s, the development of vacuum tube allowed the frequency to be increased to 10 to 300 MHz, called shortwave diathermy. The energy was applied to the body with inductive coils of wire or capacitive plate insulated from the body, which reduced the risk of burn. Diathermy or deep heating will heat deep below the surface of your skin. Any diathermy devices should be able to maintain the temperature between 104 and 140 degrees Fahrenheit, 2 inches below the skin. This ideal temperature should be reached in 20 minutes or less. Are you curious by how does shortwave diathermy work? Shortwave diathermy uses oscillating high-frequency, non-ionizing electromagnetic energy to produce deep heat into tissues. Do you know that the frequency have been reserved for medical use only? There are two types of shortwave diathermy, which are induction field and capacitive field. For the induction method, the patient is placed in the electromagnetic field produced by the equipment where the lines of forces created by the positive and negative poles. The induction will produce the greatest amount of heat within the muscle layer beneath the coil. The high-frequency alternating current flows through a coil and creates an electromagnetic field, EMF, that radiates away from the cable via a drum. EMF is perpendicular to the cable, causing the ions to oscillate. When the ion oscillated, the eddy current is created. When the ion oscillate, they vibrate and produce heat. The muscle will heat over the adipose tissue. In induction field diathermy, the amount of heat produced depends on the strength of electromagnetic field, EMF, and the distance between the tissues or sources. The number of eddy current is based on the strength of EMF and the electrical conductivity of the tissue. For the induction field method, the drum technique is common. Next, how about the capacitive field? In the capacitive field diathermy, the patient tissue are placed between two electrodes and it conducts the diathermy electrical energy. Two insulated plates or electrodes are placed on the either side of the body. which means it will hit both sides of the body, is produced by the dipole effect. So, pairs of equal and opposite charges are separated by a distance. Current will flow along the path of least resistance and the heat created in the superficial tissue. To ensure the heating, the electrode must be placed at an equal distance from the skin from the opposite side of the body part for about 3 cm from the skin. So this is the equal distance of the body part when we are heating. But if one electrode is too close to the skin than the other plate, it is going to have more heat at the electrode near the skin. The question is, are there any advantages of using shortwave diathermy as a treatment? Well, of course it has. Electromagnetic waves are the basis of pulse shortwave diathermy. These waves create heat and help to increase the blood flow within the body tissue. By that, pain and inflammation can be significantly reduced. Other than that, joint and muscle spasm can also be alleviated. Do you guys know treating injuries with heat can increase the blood flow and make the connective tissue become more flexible? It also helps to reduce the inflammation and the incidence of edema or fluid retention. By increasing blood flow to the site of an injury, the deep heat generated by the diathermy can help to accelerate the healing process. Obviously, there are pros and cons in the treatment of injuries by using shortwave diathermy. We know that shortwave diathermy is using electromagnetic energy that can cause extreme heat in the metal device. Therefore, it could cause burning in the tissue near the intimate of the patient. During the diathermy treatment, you need to become a part of the electrical field. As for that, touching a bare metal object, including the metal part of the diathermy cabinet, can cause a serious shock or burn. Please be aware of this. It's not just that. Treatment using shortwave diathermy should be avoided over open growth plates in children, and there are conditions that can increase the risk level when using this treatment. First, the patient is having a pacemaker or any other implemented medical devices in their body. Second, patient with malignant tumors or fracture in the treatment area. Last but not least, pregnant women. They should absolutely avoid this treatment using shortwave diathermy because of their high risk. As conclusion, shortwave diathermy has both advantage and disadvantage. However, this device can be very useful in medicine and it can help to treat patients in many ways as long as there are enough safety precautions and the patient are under the supervision of professional doctors. That is all from us and I hope you enjoy our video. Thank you!